lowest. It's really quite an extraordinary accomplishment done not by the governor and myself, but by New Yorkers for adhering to all the requirements we've asked them to follow, wearing the masks wherever they're out, whenever they're out in public, social distancing, washing their hands. It's all made a difference. And that's what's so incredible about this story is we're hopefully seeing the light at the end of the tunnel, but we have to caution that this virus is wildly unpredictable. We've seen in other countries that thought they were through the worst, where there's now been a resurgence of the virus. So we're studying those trends very closely. But right here, as we're about to enter the month of August, we're in a great place compared to just we're March, April, and May, no doubt about it.
So one business that a lot of people are concerned about are gyms. So if the state is in such a great place right now, why have gyms not reopened, and where do we stand on regulations and certain rules for gym owners?
Gyms are being studied as we speak. We are working on protocols that'll make sure that when they do reopen, and then they will reopen, that the environment is sterile and that the virus does not have the opportunity to spread there because of the activity. Now, there's been a reason why they have not been able to open, and that's based on not what the governor and I want to have happen, because we do want to see all businesses reopen in New York. But two things. One is that the infectious disease experts that we listen to, and I just spoke with the head of infectious diseases up at the University of Buffalo Medical School, and this was reinforced when I was in Syracuse and Rochester talking to the experts. They think that it's just a bad environment where the virus can spread more easily than in other indoor environments, and they're concerned about it. So we can't ignore that. And we also have seen other cases where states that have not had the same rollout the way we have, that they opened early, and they're seeing increases in cases related to people spreading it at gyms or going to bars and restaurants. And so what we don't want to do is open certain sectors of our economy, certain businesses, and then after people have been called back to work, off of unemployment, everything's going fine, and then they have a spike and they're shut down again. That's even more devastating. We've not had to do that, and we don't want to do that in the state of New York.
Is there any kind of timeline for when we can expect guidelines, or are we still just waiting on what the virus does at this point?
We're just still in a waiting mode right now, but every day that goes by when the numbers are looking better, I would expect it to be sooner than later now.
Yeah. So another issue that was a major issue in New York, especially here in the southern tier, was nursing homes. In Steuben County, the county reported 31 nursing home deaths. The state is still reporting 11 in Steuben County. The nursing homes in the county have all said all those deaths have been reported to the state, but I think it's been a couple months at this point where that 11 that the state is reporting has not updated. So where's the disconnect in those 11 deaths versus 31 that the county is reporting?
You know, and I think one of the reasons you talk about how New York ended up in the place it is right now is that we've been extraordinarily transparent in letting the public know, literally with governor's press conferences day after day, and his continued reporting to the public on what the numbers are. What we've adopted is a policy around the state to count the number of deaths that actually occur in the nursing home versus in a hospital. And so there's always a opportunity for discrepancy, but that's the standard we're using throughout the state. But I know that New Yorkers trust our numbers because we have been very candid and very open with respect to making sure that everyone knows what we know in real time.
So the deaths that are on that state database, are those people who have died in the nursing home, and it's excluding the residents who may have died in a hospital or in another facility?
My understanding is, according to the Department of Health, that these are individuals who've actually died in the nursing home.
Okay. Right now, Congress is talking about the next stimulus bill and the stimulus checks. What would you like to see in that bill? I know a lot of people are talking about the $1,200, $600. What would you like to see for New Yorkers?
Well, starting off, what we need to have for New York is a large infusion of money to come to our state to help us offset the horrific loss of revenues. We're down over $30 billion over the next 2 years for our budgeting, and that's partially because of the additional expenses incurred from fighting the pandemic, as well as the loss in revenues. And this is not just hurting New York, it's hurting counties and cities and towns. And it's going to hurt our ability to fund the essential workers that we've all relied on, whether they're healthcare workers or our educators, our teachers who've had to almost do the impossible trying to keep the education process moving while they're disconnected from their students. It's been an impossible situation. But the last thing we can do is to cut funds for programs like those, as well as our law enforcement. And that is actually a very real possibility if the Republicans in the Senate do not approve a stimulus bill to the tune of at least $500 billion, which is what Governor Cuomo is saying we need for the states to be able to just start recovering from this. And there is no recovery for this economy if New York State does not come back. The national economy hinges on what happens in New York City. We are the epicenter of many industries, and we can't afford to have that happen. But we would like to see as much money can be given directly to residents to help them get through this. Again, these programs, unemployment, for example, were set up at a time when they thought that by now our economy would be back. Well, it's in a better place in New York, but the rest of the nation that didn't follow what we did in New York, they had their own ideas about opening businesses much earlier than was safe to do. And they're even talking about opening schools in Florida next week, which is absurd. We followed a different path, so we're in a good place, but unfortunately the rest of the nation is now hurting. And until this all comes together and we can beat back this virus, there are going to be people without jobs, no fault of their own. They didn't ask for this pandemic. 1 year ago, we had about a 4% unemployment rate. Right now, it's upwards of 16%. That's no one's fault. They deserve to have the additional $600 per week just to get them over the hump so they can make their rent payments, put food on the table, take care of their expenses, and not have to suffer because this came to our country unexpected, unwelcome, and it's hurting Americans, particularly New Yorkers, really hard.
So a follow-up to that, you mentioned the schools in Florida reopening. What would you like to see with schools? Should it be a hybrid course? Should students just stay out of schools for the first semester? And do the same rules apply for elementary schools, high schools, and colleges?
You know, this is an area where we are going to allow each school district to know what their capabilities are, how many students we're talking about, how they can create social distancing within the classroom. Do they have enough space with all their facilities, all their buildings in a school district, or do they need to have a staggered program where maybe the high school juniors and seniors work more remotely and you fill up their classrooms with younger kids? So there's a lot of creativity going on, but the state of New York has issued over 144 pages of regulations to meet very high standards for protecting the health of our children and teachers and administrators. Every school district is required to submit their plan to the state by Friday. And within the next week, we'll be able to make a determination on whether or not they can go forward. But we believe that they're working very hard on this. And I give them all the credit in the world for having to endure just the unthinkable, trying to figure this out. And so what we're trying to do also is to make sure that we have the right numbers in place. And that means that the infection rate has to be below 5% in any region that wants to reopen. And many cities and states are seeing 15, 18, 20% infection rates in other states elsewhere. Luckily for us, we're averaging, as I mentioned, about 1% in the state. If that number holds, we will be able to give the green light at the end of the first week in August to say that the school districts can proceed overall with the individual approval of their district plans. So I don't have the answer right now as to what's going to be best for one area, but they have to meet very high standards put forth by the state of New York to make sure that our kids are safe.
Absolutely.
And Georgia, one more then.
One other thing that you mentioned was the industry. Kodak and Corning Inc. have received a lot of funding. So what has that been like to see the upstate New York businesses start to get that funding? And also, while I have you, Vice President Biden expected to pick his vice presidential nominee, expected to be a woman, possibly a woman of color. So first on Kodak and Corning, what's it like to see those businesses get that recognition? And then Vice President Biden's potential pick of a minority female.
Well, we are so excited to see Kodak being funded so they can do critical life-saving research to develop medicines and elements and chemical elements that are necessary for cures and vaccinations and even just the reagents that are so needed for our testing. And so this is something that Governor and I have been talking about all along. It was absurd early on in this crisis that we had to scour the earth in search of protective equipment, gowns and masks and ventilators and reagents and vials for testing kits. They should all be made in our country, and why not in the state of New York? So as part of our Build Back Better initiative, where I've been traveling around the state in Rochester just recently, talking to business owners and others, and I'll be down in the Southern Tier next week, speaking to them about how we can retool some of our factories to get them manufacturing this equipment, because I hate to say this, but this pandemic may end this summer, may end this fall, but it's not likely, and there is a chance of a resurgence based on what's happening in other countries. So knowing that, we should never be caught off guard again, where we're held hostage to supply chains, global supply chains, where we're literally competing with people from other countries and other states for supplies that we can manufacture right here. So that's going to be good for our job growth as well as we start to bring people back. With respect to the vice presidential pick, it's very exciting. As a woman who's in the #2 slot in the state of New York, I know how important it is to have gender diversity. So you have the perspective of 50% of the population, and that's what I've been providing to Governor Cuomo here and to our state. And I know that that's been a good dynamic. And I think the president, soon to be hopefully President Biden, is pursuing that same dynamic where you can get the different points of view and different life experiences, and to have a woman, and if it's a woman of color, how extraordinary that'll be, that as we celebrate the 100th anniversary this year of women's right to vote in the state and in our nation, that it'd be a wonderful testament of the progress that we've finally made.
All right, Lieutenant Governor, thank you very much for joining us today.
All right, thank you for having me.
Thank you.